here and just share with you our plan for how we intend to move forward with the remediation project. And also just let you know that we're really trying to honor our commitments that we've made to the town. It's very important that I live by rules of integrity and respect and trust. So it's important that we honor those rules, and part of that is being here tonight and sharing with you our plan and listening and answering your questions. So as the mayor had mentioned, we really only have about 3 agenda items to cover tonight. What we wanted to talk a little bit about was the status of the activities since our April 21st meeting with the town that the mayor referenced earlier. We also wanted to give you a summary of the pilot modifications that we made as a result of a lot of conversations that have been going on between the town, Shore Regional Health, and our company that we plan on doing the remediation with. And then also we wanted to share next steps with you about where we see the project moving forward. So this part of the agenda may only take 15 minutes or so to get through, but then we'll certainly answer any of your questions. If you'd like, you can stop me at any point in time and ask your questions as well, if that makes better sense. So the status of the activities since the April 21st meeting. As I mentioned, there's been a number of discussions between Shore Regional Health, Mr. Bud Ivy, who is the principal associated with the solution that we intend to use to remediate the oil, and with members of the town, town managers, the mayor, and many consultants and experts that were brought in. Those discussions have yielded very fruitful recommendations and very fruitful advice and counsel on how we can create a pilot study that is not only a very conservative approach to what we need to do, but also a very safe approach from the town's perspective and the water supply's perspective. So I believe from those conversations over the last 2 months, we have really listened and learned, and as a result have really made revisions to our plan based on a lot of feedback, and of course the Maryland Department of the Environment is also part of that process. So we want to share those thoughts that were presented to us by the town, and also share with you our response to those thoughts and how we've incorporated those into the plan. And then what we've also done is, since the April 21st meeting, is shared our timeline with Mr. Ivy so that we can get his time booked for the initial pilot study. As you can imagine, he's got projects going on all over the country, and trying to get him locked in on dates and times so we can benefit from the water table, benefit from his expertise and his timeline and availability, and do this in a manner that's appropriate for all of us. So we've been working on coordinating those times with Mr. Ivy, and I'll share with you what we're looking at as far as a possible pilot study date. So that's a status activity update from our April 21st meeting, and the things that we've accomplished since then. So some of the specifics. We received a very well-written, detailed letter on behalf of the town with several points. There were 8 points in total, recommendations for modifications to the pilot study that we received from the town. It was signed by Mr. Mark Eisner, who is, I believe, the president and principal of the legal firm that the town is using for this project. So Mr. Eisner, I'm sure, had many conversations with the town and crafted this letter on the town's behalf.
He's not a lawyer, he is our
consultant. Thank you very much. I appreciate that clarification. So the town's consultant was instrumental in helping craft this letter that was addressed to Mr. Dane Bauer, who is our consultant and who Melissa works with. So Dane couldn't be here tonight. He wanted to be, but he's suffering from whatever it is that's going around, and probably best for all of us that he's not here this evening. But our intent really was not to make this a technical discussion. It was really to provide you with an update on what we've learned, what we've heard from the town, and how we've modified our plan to create the pilot study. So from the letter that we received, and it was dated back on May 9th, we worked with the town. As we said we were going to do. We had conversations. We identified the specific issues and got clarifications from the town's point of view as to how the pilot study should be modified. And we took each of those under consideration. And I'm pleased to say that of the 8 that were presented, we have implemented 7 out of 8 of those into the new pilot study. And the only reason that we didn't implement the 8th of 8 recommendations was just after consultation with MDE and with some of our experts. We felt it was a less conservative approach than the approach that we've built into the pilot study. And again, I'm not a technical expert, so please don't hold me to the technical aspect of the study. But what I'm here to say is that we've listened. We've understood your perspective as a town and the citizens of the town and your concerns. We've modified our pilot study to make it much more conservative. We've modified it so that it involves less of an area than we had originally identified. And again, I'll go through the points of each of these and let you know how we've changed those things. But we've listened, we've adopted those recommendations into our plan that we'll be submitting to the MDE tomorrow. So, yes,
Can I
sir.
ask the authors of this paper that you're referring to gave one?
The author of the paper is Mr. Eisner, Mark Eisner, and he is listed as, I believe, President of Advanced Land and Water, Inc.
Thank you.
You're welcome. So if you'll allow, the third agenda item was to go through those items of the town's recommendations, and I'll just share with you what they are. And we can certainly make this available to you if necessary, because it's a town document, so I'd be surprised if you haven't seen it yet already. But the first point wasn't really regarding the pilot study, it was just regarding the financial assurances and guarantees. What support do we have in the event that something goes wrong, that the system, the University of Maryland Medical System and Shore Regional Health will address and respond to the town's needs based if anything goes wrong? Do we have the financial wherewithal to do that? And our response is yes, we do. We've contacted our legal counsel. In addition to policies, we've got the assurances from our counsel that we are covered in that regard. So I don't have any concern about that if our lawyers don't, and I feel confident that but through a legal means we will be best representative and support the town in any way necessary and possible. The second item talks about the hydraulic control during the Ivysol pilot injections. And in a nutshell, I believe what this means is that originally in our pilot study, we were thinking about not having the pump and treat run while we were doing the pilot study. The town brought back some great concerns and said, why can't we? Is there any reason why we can't? And we've investigated and we agree that there is no reason why we have to shut it down. We can leave it on while we're doing the pilot study. And that provides a greater level of comfort and control in what we're trying to do with this project. So we've agreed to that and built that into the new plan. Concern over the efficacy of Ivysol and released contaminant removal after injection. I believe that, again, we've adjusted our pilot study to address this concern.
This was the issue about the dye.
Oh, thank you. Thank you. So this is one issue with the dye. And if you'd like, again, MDE is here to help support, and our consultant is here as well. But the dye, I believe, solution is used to just determine and confirm that any Ivysol solution has been either, I guess the word's not deteriorated, but it's been dissolved or it's been effectively removed. And the dye is one way that we can assure that that happens. But it's our sense that the Ivysol solution itself is our best marker for what's been removed and not removed. That the dye itself doesn't provide the same level of conservatism into guaranteeing that solution's been removed. And perhaps Melissa,
I think also the dye is absorbed quicker and it's not as good of a tracer as the Ivysol solution will last longer. So using that and using the EPA methods for testing that is a safer guarantee that everything has been removed. So it lasts longer, therefore, yes.
The purpose of the dye, since we were talking about 4 individual wells, was to put different colored water in each one of the wells. This was for the static test. Once we went to having the recovery system running, that all became a moot point. What that was meant to do was demonstrate hydraulic control at individual wells before any chemical injection into the groundwater. So it was simply dye in one day, dye out the next day. Are we getting the same dye in this well that we put into it, or are we getting the one that we put in over here? To get an indication of how the water was moving before the chemical injection. That's all. But since we're running
with the pump and treat, we're okay. Well, then I changed my original statement then with the new explanation, and thank you for that. It seems as though we've addressed all of the concerns in the town's letter because the pump and treat negates the need for the dye. Another issue that was raised in the letter was the number of wells to be included in the pilot for injection and extraction. We had originally wanted to do 6 wells, and the town got a better look at the plat and decided that perhaps a more conservative approach would be to use 4 wells instead of 6, and we agreed. So we modified our proposal or our plan to include only 4 wells in the initial pilot study, and we'll see where that goes from there. travel time and hydraulic control to capture the residuals. We got confirmation on the travel time for the solution. We believe that the travel time associated with the cone that we're talking about is not an issue with regard to contamination with the rest of the well. So that issue was raised, and we confirmed that into the plan as well. Proposed consent agreement with MDE. We talked a little bit about that at this point, but we are not prepared to move forward with any consent agreement until we can really get a sense of the MDE's response to our pilot study. So we want to make sure that we're on solid footing before we even pursue that discussion. And then the status of submittals to MDE in the town. We have, I'm assuming that this references when we would actually submit the plan to MDE, and it's our intention to do that tomorrow after we've had this briefing. So I think what we've shared is in a nutshell, again, the town's concern in written form with several points raised about our original plan with the pilot study. Our teams have sat down, reinvestigated our plan, and have come up with alternate solutions based on the town's recommendations. So I believe that is what we said we were going to do, and that is what we will build into the plan that we will submit tomorrow. The last area we wanted to cover is just next steps. And what we see happening at this point is, after today's briefing, we envision submitting to the town our recommendations in the plan tomorrow. The town will, submit our plan to MDE tomorrow. We believe MDE, and Chris, please correct me if I'm wrong, but we've got a timeline of about 3 weeks from the time that we submit the plan until we think we'll get approval or obtain approval from MDE. That puts us into about the middle of July. At that point then, we've negotiated with Mr. Ivy to hold the dates of July 28th of this year, of this coming month, as the time when we'll start the initial pilot study. So if we can get MDE approval before then Mr. Ivy is available on July 28th, and it's consistent with the timing of the water tables and the timing of what works for him and what works for all of us. We expect that if we are able to start the study on the 28th, it should not take that long. It would only run till August 1st, so it's only about a 3-day pilot study. We would get the results of that study back by September 1st of this year. We would then schedule another town briefing after that point in time to talk about the results and talk about the effectiveness of the pilot study, and then our potential plans for continual studies based on the success of that study. Of which we would then consider submitting an alternative plan for additional studies as of around the middle of October of this year.
And during that time frame, will the recovery system remain operating?
My sense is yes, during the entire time period, yes. And when you say recovery system, the pump and treat?
Yes.
Yes. So
If I can add just one.
Yes, sir.
One of the reasons that question came up just now, but it's going to come up again, is that we know that in a previous test that the pump and treat system was cut off, and I happen to live just a few blocks from that site. I was never notified. And MDE has informed me that was a mistake. And they're sorry that word didn't get to Bob Sipes or to other people in the town. But, sir, you added to that concern of mine at this meeting back in April, when you informed the group there that you had a private agreement with MDE such that you did not have to share information with the public. Did I understand that correctly, or did I misunderstand?
if I stated that, that's not what I meant to say.
Okay, so that's great. That's great to hear. So you do have a commitment to share with the public anytime that system is cut off?
I think with our consultants here who help us navigate through that, yes, we can.
No. Will you comply with MDE and EPA regulations that require you to share that information with the public?
We will comply with MDE regulations.